you would have known that we cover quite a lot over the year in trying to keep pace with what's going on with the COVID-19. I'm delighted once again to welcome close to 600 people who registered. I'm not quite sure how many people is going to be with us. I'm giving the statistic that we have over 300 people from the consulting industry, 92 from different sets, and the mass statistic good going on. I'm so pleased to welcome a lot of speakers from all over the world today to join us. So today we are looking at the health infrastructure. Has it taught us any loss in the construction industry? Have we learned anything as a result of this COVID-19? Do we have adequate health infrastructure, or do we need to reconsider our investment in the near future? I have a number of panelists today who join us, which I'll introduce to you in a bit to try and share some thought on this subject. I am told that we have people from all over the world, who are actually engaging with us today, with 600 plus register. And I think it'll be interesting to see how many people participating. But just looking through the process, as we always do, we invite our President, Bill Howard, to say a few words at this point in time to welcome you and to say, welcome to our so Bill, would you take the floor and say a few words?
Yeah, well, thank you very much, Nelson, and I will be very brief. I'd like to thank you, Nelson, and your Secretariat staff for continuing these webinars, which, as Nelson indicated, have been very successful. We've reached out to thousands of people around the world and continue to do so. And that is just absolutely fabulous for FIDIC's future, and hopefully we're adding value to a lot of people. I particularly want to thank the speakers today. We have some top-notch folks from all around the world. We've got 5 of them, so we're going to be a little bit squeezed for time, but thank you very much for spending that time with us. As we start this round of COVID webinars, a lot of us hopefully can see the light at the end of the tunnel, but we're only at the beginning of the tunnel. With vaccinations, et cetera, starting to be rolled out, I think there's a lot of hope. And as we'll hear today, there's a lot of lessons that we've already learned. Perhaps the biggest one is to expect the unexpected as we move forward. I think a lot of us feel the post-COVID world is going to be different. Perhaps none of us know exactly how, but I think we all agree it'll be different. So with that, thank you very much for all your participation. I'll turn it back to you, Nelson.
Thank you very much, Bill, for that warm welcome to this particular program. Just going through the protocol today, I just want to remind you that for those who are new, last year we staged over 21 webinar, and out of that webinar, which was 18 focusing purely on COVID-19, and we had 3, which was the future leaders, collectively 21. We had over 15,000 people that registered for that particular webinar, as Bill mentioned, with 9,000 actually participated in the program, and from 150 countries around the world, with close to 80 speakers. We've now been informed, rather than 10,000, we've got close to 15,000 people that's watched our webinar on YouTube, which means if you do miss this opportunity, there is an opportunity for somebody who missed it to actually catch up. This year, we are segmenting our webinar into 3 parts. One is to do with our committee webinar, which is looking internal and how do we support our member association, how do we support our firms, and how do we deal with that. So we started with that one last week, and we'll be doing this in every other weeks. So the webinar for committees is already started. We do have webinar which is focused on the state of the world, which is a series of reports that will be starting sometime later this year. And you will get that coming through. But today we are focusing on COVID-19. It is still COVID-19. Last year, we were talking about coming out of COVID-19. The truth of the matter is we haven't come out of the COVID-19. We are still in it. We're going through different parts of it. Now, when you look at global implication, I think we've had close to, what I thought about 102 million cases around the world who's been impacted. And to be honest, the figure as to the level of death is not very good at all. Close to 2.3 million people die from COVID. And may their soul rest in peace. But more important, our condolences to their family, for those who lost their loved one. When you look through, as Bill talked about earlier on, which is the issue to do with what we classify to the vaccination, The vaccination situation, I think, is questionable. We start to say, where exactly do we need it, and who can afford it, and who can't afford it? The truth of the matter is, when you look through the globe, most part of the world, they've taken appropriate caution. They've placed an order, they can afford it. But you can also tell that when you look through across in the developing country, there's a huge gap between the needs and what is available. I am told in countries such as Australia, where the infection rate is being properly looked after, and we hear from Kiri later as what's going on in Australia, that they've got good, supply, or they will have good supply of vaccination, but actually their needed, is actually required. Compared to Africa or Latin America, and also when you take the country like UK or continental Europe, the challenges is there. So from our point of view, the question we put in to ourselves really is, are we, in a position where we can defend ourselves in the future? This is a real challenge. So from that point of view, the first thing that I'm actually going to put across is really to test the market. Do you think, and this is a really poll for everybody who is actually participating, do you think that we actually have our current infrastructure that is sufficient to address the issue with COVID in the next 18 months? Bearing in mind that we have not come out of it yet. Bill talked about, we can see some light at the end of the tunnel. The question is, how long is that tunnel? And do we think that we have sufficient healthcare infrastructure to cover what we need over the next 18 months? Time to vote. I would suggest, the opportunity to vote is there. Please, press the button. You have the option. And within a second or two, we should get the feedback. But while I'm waiting for the feedback, some of the lessons that I've picked up is that I hear from countries such as UK build huge, hospital called, Mary Nightingale Hospital. What they actually used, and in terms of what is the role of the engineer trying to find a solution, how often and well is our industry being able to respond to this particular issue? And these are the challenges that we're facing in terms of how do we go forward? Do we have the right infrastructure in the healthcare? Is our hospital fit for the future, or do we still have a long way to go? So in the first case, looking to the next 18 months, are we ready? What is the result? I'll bet to know. Barbara, are you able to share the feedback with us at this point? I think that doesn't surprise me. That this statistic I'm getting is only 12% of people actually felt that we have something that is fit for the next 18 months, and maybe 33%, overwhelming 55% saying we do not have what is fit for at least next 18 months. I think there is a message there that is coming through, and maybe the panelists will take that on board in their conversation. We've got, well, roughly 12, 33, and 55%. So that is confirming that we do have a lot of work to do. So on that note, I am actually going to start with the panelists and basically invite them. I'm delighted to introduce our 5 panelists. We've got Anne Kerr, who is from Hong Kong, from Mott MacDonald, and she's the managing director of that particular group in Hong Kong and China. I've got Ben Coran, who is from Aurecon, and he's the leader for health sector, I'm told. I did say earlier on that he was the global leader, but he tells me that that would be a promotion, and I will endorse that after today's meeting. Then we got Kiri Parr, who sits on our, FIDIC contract committee, and she will give us a bird's eye view. And then Eric is from United States, and she's the vice president of our member firm, ACEC, and she will give us her perspective on what the market trend is. Then we've got our Graham as well, who's our head of economics and strategy policy, to give us his statistics. Some of them are actually mind-blowing, but I think it'll be very helpful when Graham gives us, as much as he's going to give us some negative, but to give us some positive news. So on that note, I'm going to start with Anne. Anne, would you give us your view on the state of the situation? Do we have adequate health infrastructure in China, in Hong Kong? From your perspective, what can you share with us? Anne, the floor is yours. Thank you.
Nelson, thank you very much indeed. Thank you, Bill. Thank you, FIDIC, for giving me the opportunity to share a few thoughts. I think that the answer to the question is we have learned a lot. There's a lot of lessons that can be learned from the health infrastructure. I don't think that it's wrong to say that we have got some good solutions, but there's a lot more that can be done. We've learned many lessons. I think that we can take lessons from the construction of temporary hospitals. So it's not just in the London area where the Nightingale Hospital puts up 4,000 beds in 2 weeks. We have similar situations all across Asia and so forth. The question, though, that was posed was how many people are using these hospitals and how many people are using these facilities. But perhaps that's for another day, another conversation. I think the first part of this discussion today is, are the facilities that we have able to be adapted to field testing centres? Can we adapt other facilities for similar purposes as we go through the next 18 months, 2 years, etc.? This leads me to think very much about the consideration of flexibility of our infrastructure, be that health or other types of infrastructure. And it also leads me to think very much about what we need to be doing in all of the work that we do is designing for secondary purpose. Now, I talk about this a lot, and it's very easy to say, but it's not actually very easy to achieve when you consider that if you're thinking about the secondary purpose, flexibility, etc., you've got to think about design codes, you've got to think about statutory requirements, you've also got to think about the forms of contract. Now, FIDIC can help out greatly here, but I think that these are the areas that are really important for us to be thinking about going forward. So today, I wanted to start off in this introductory session with 3 points. The first one is about the construction program and the periods of construction. The second one is about construction costs, and Graham, I know, can give lots of stats on that. And then the third part is about the designing in resilience into new facilities. So thinking about the construction program and the periods. So can we actually achieve construction at the rate that we were achieving it pre-COVID, even with design for manufacturing and assembly, MIC, rapid flexibility, adaptation, etc.? We can to some degree, but in the bigger picture and in the longer context, we think about the ability to deploy specialists, international specialists to various countries, and what are the restrictions on people moving around countries now compared to 2 years ago or even 1 year ago, as Nelson said. The willingness of people to travel and work in other places might be less than previously, for a period of time anyway. The impact of workers' accommodations. We've seen some shocking situations in workers' accommodations and the high transmission rate of the infection of COVID-19 in workers' dormitories, etc. These need to be improved. These need to be upgraded, and they can only be used if they are upgraded to help us actually deliver more facilities faster. Think about the construction costs as well. Will the construction price index increase because of the difficulties of moving facilities and people around from country to country, state to state, etc.? Will the availability of specialists also increase the construction costs? Will this, however, give more opportunities to local people, and will it allow training and retraining of local supply chains, etc.? So there is potentially an opportunity here, not just a downside. And then think about the third point that I want to talk about, which is the design for resilience. So we really need to think about designing resilience into facilities from the start to reduce measures that transmit risks, and think about the disease transmission from an epidemiological perspective. Think about how we see the retrofits in some simple forms, like, for example, in shopping malls, we see UV cleaners on handrails of escalators. Very expensive to retrofit, but not so expensive to design in first time round. So let's think about designing in resilience first time round. Let's also think about the fundamentals as well, the fundamentals of clean water, and also the basic fundamentals in terms of public health. We also need to think very much about the cost associated with building in resilience and the buffers that we need for the infrastructure to be epidemiologically more secure and safe. And I have read some horrible statistic which said it would take 500 years to spend as much on investing in preparedness for another pandemic as the world is losing due to COVID-19. Graham may have some more stats on this, but let me just pass the floor over to the next speaker to give some more thoughts. Thank you.
Thank you very much, Anne, for that quick insight into your initial 3 points, which I really very much like. Issue about cost, issue about construction program, and design flexibility. I'm going to invite Ben now, Ben Coxon from Aurecon, to give us your perspective on the subject. And I do say to the speakers, please, you have up to 6-7 minutes there to share your thoughts. And if you do need to extend it, so be it. We can manage that timeline. So Ben, the floor is yours.
No worries. Thanks, Nelson. I won't, hopefully I won't disappoint you. Nelson, thanks for the kind introduction. Mine will be it'll be largely an Australian perspective with a sprinkle of broader observations. And in Australia, we've, relatively speaking, we've been quite fortunate, despite there's been some tragic loss of life regardless, but there are significant learnings. So as to moving to the question, the lessons, there are lessons in the construction sector arising from COVID, but I think these lessons, it'd be inappropriate to say that it's only for the construction sector. There's broader ones for the health system and for all of us as professionals and the broader community. So my perspective, I've seen it as 3 key learnings or 3 areas. One is around resilience, building a little bit on where Anne has gone on the resilience subject. Secondly, around digital and technologies. And thirdly, around procurement. Underpinning that from a societal perspective, and it was great your slide early on there, Nelson, the overarching, our overarching purpose has to be that there's an overarching fundamental right for everybody in the world to have accessibility to quality healthcare when they need it, what they require. And I think as a peoples, we have some significant work to do. If I look in the Australian context, we've made some great inroads, but we still have some disparities, whether it's delivering health services remotely to aged, to the disadvantaged, to Indigenous or First Nations people. We still are coming up short, and we still have work to go in breaking those inequalities. So to the first of the 3 themes, and the first one around resilience. It's interesting. Australia's got a history of dealing with extreme weather events, perhaps no more than anywhere else, but it's one that's very clear in my years. And in the last year and a half, we've been hit again in terms of the East Coast fires in New South Wales. Over 19 million hectares were destroyed. Some 25 homes went with those fires, and over 500 direct and indirect deaths. So what's the point there? That resilience is about infrastructure, but it's also about a mindset in dealing with events. So healthcare represents it's a top or second top budget item for all the jurisdictions around the world, expenditure, and resilience is a must-have. But briefing for the resilience is not new. It's been in place for a number of decades. The robustness of it is what is coming into maybe question and more focus. It's becoming more significant in terms of what's been sought from client due to climate change and client requirements. As Anne says, there's an enormous cost that goes with this if assets are if it's overlooked, if it's overbriefed, or it's overdesigned. And so what's the role of the construction sector? It needs to continue and up the ante in terms of working collaboratively with the principal in unpacking these issues. On a 1.2 billion USD hospital we completed in Australia in the last 3 years, the brief for pandemics and acute weather events was significant. Whether you're talking about storm surges, seismic events, isolation requirements, negative pressurization requirements, ward repurposing, and full pandemic planning, it goes on. Another aspect of resilience is around adaptable building design. And it's critically important that the building stays there as long as possible. Why? Because technology and medical practices are changing at a breakneck speed and a lot faster than what the physical structure can change. So there is a need to design the building and to deliver a building that's actually a chassis, but something a bit maybe akin to IKEA, that it can accommodate change. And this needs to be at the foremost, at the front of mind for the client and the designers. So the role of the construction sector is significant there. But furthermore, the construction sector needs to have an acute understanding in relation to the changing paradigm in health technology, because to actually respond to this increased level of resilience. The second theme is around digital and technology. And it's fair to say, I think we'd all agree the construction sector is often polarized, and we being part of that, by project completion as opposed to enabling transition into operation of assets. This again, COVID will be a stimulus for the change to this, I believe, in terms of the cadence of that change, in terms of digital health. The contracting sector needs to have a developed and increased, enhanced understanding in relation to digital health trends, which again, COVID's not directly responsible for the direction of those trends, but it will actually, I think, disrupt it and actually move it along a lot faster, which will be well received in a lot of quarters. Whether you're talking about digital tools to construct virtual reality mock-ups, it's been done. It's got to be done a lot more to achieve the efficiencies that we need. Data analytics and adaptive learning in relation to optimizing plant in operation and reduced energy consumption. As I said, construction sector's role's got to go beyond practical completion. And the use of digital twins to actually develop road test and work on models going forward. But so outsourcing. So what's the message and all that? The second theme is outsourcing that critical understanding, something that the construction sector can't do. It has to have a hands-on understanding. Finally, my last point is around procurement and relates to, and I'll give a really quick, very simple example. Having been engaged at Melbourne Monash's Medical Centre for their emergency department reconfiguration in the last year, with COVID coming along, that created a level of unsettledness, which was quite significant for that facility. And they needed to very quickly, over a matter of weeks, put in place temporary units, prefabricated modular units to deal with patients presenting with COVID. So that wasn't the challenge. The challenge was something very simple. It was about this big, and it's actually the procurement of the bed head panel. And believe it or not, even in Australia, we source those from afar. And in this instance, that wasn't possible. So with the innovation and collaboration of the client and all parties, we got to a very good outcome there. I think we have seen this simple acceleration of concept to delivery, but the prompt or the hypothesis I'm left with is prefabrication and modularization, 3D printing, robotics and automation. They've been in many sectors for a long time, less so in built environment. And I think there's significant learnings there for the construction sector to go forward to achieve some of the economies that the market is seeking there. In the Australian context, we saw minimal stoppages in the last year on construction. Tier 1 contractors learnt to adapt over several projects. But the one message was that when we have our health services and our health service providers, their business continuity planning, their crisis management planning is quite significant and underpins that sector. When I come across the construction sector, it's one that risk assessment, or the assessment of risk and opportunity, is in their DNA. And so what they had to do was to actually, treble that or, many-fold increase in that sort of thinking. But I think it's fair to say they came for a long way back, and that has created some significant learnings, whether you're talking about supply chain. In Australia, I can joke, having lived in the country for a long while, Australia fits into about 90, bit under 90% of Greater Shanghai. We can't afford a local supply chain that does everything. What I say is we've got to have a local supply chain that's got the capability to pivot, not necessarily a 24/7 capability. And there are a number of other learnings there, Nelson, in relation to the sector. I'm happy to pick up in questions. So just summing up, there are 3 lessons there I see, key lessons around resilience, digital technology and procurement for the sector. But it is really learnings for all of us professionally and society at large. And underpinning that needs to be this focus on global wellness and people and patient centricity. Otherwise, we'll falter going forward for future pandemics. Thanks, Nelson.
Thank you very much, Ben, for that. Precise. I think the message I heard, one is about resilience, which is building on what Anne said. Second one is about digital technology, and the third one is about procurement side of which is quite interesting. And I suspect, it seems actually quite natural that Kiri should build on that. And I'm going to invite Kiri now to give us a helicopter view on the subject from the big issue of procurement and contract. So Kiri, the floor is yours.
Thanks so much, Nelson. And there was an awful lot in Ben's and Anne's discussion that I'm sure we'll pick up in the discussion group. My old debating days are coming back to me. I don't have rebuttal, I have exposition. But what I thought I'd start with is a little bit more of a helicopter view about large complex projects and events, because things like pandemics and large health infrastructure projects and even earthquakes all share something in common, which is that they are complex projects or complex events that are the function of the complex systems that they're working in. And, 30 years ago, we thought we'd be able to work out how to predict when the next earthquake would happen. And the scientists went away to work out how to predict when the next earthquake would happen, and they couldn't do it. It's a complex system. So we know if we're going to get an earthquake or a pandemic, or we're going to deliver a major infrastructure project, but we can't tell you when or how big the next earthquake is. In the same way, we can't tell you when the next pandemic is going to happen and what the consequences are precisely. The other thing about these major projects is they don't follow a bell curve. They don't have an average poor performance. There's always the risk that the next earthquake or the next pandemic or the next major infrastructure project is going to be worse and have worse outcomes than everyone that's come before us, which makes it absolutely critical that we look at these projects and we really investigate, or we really pay attention to the lessons and this conversation that I think is part of it. And to the extent that you can't avoid them, and I don't see how we can avoid pandemics or earthquakes, maybe we could make decisions about whether or not a major project is something to take on as a country. But if we can't avoid them, then what we have to do is mitigate the risks, which means we need to look into our past events, be really realistic about these, and look at those strategies that work. So that importantly brings me back to, and unfortunately I'm also Australian based like Ben, and when I got this topic I went, oh, let me look at what's happened in the Australian market. What has our history told us about major health infrastructure projects? And look, I hope this is a little bit unique, but we've had 4 major health infrastructure projects delivered in Australia in recent years that have knocked it out of the park in the form of poor outcomes. They are the Royal Adelaide Hospital, the Perth Children's Hospital, the Northern Beaches Hospital, and the Queensland Health Department IT payroll system. And I include that last one because I think when we talk about health infrastructure, and I don't know about everyone else, I don't think about health as just a hospital. It's also the technology, the systems that sit behind hospitals, the shared medical information, the payroll systems. They are all large and complex pieces of that puzzle. Now, 3 of those projects ended up in parliamentary inquiries locally, and lots of lawyers made a lot of money running a lot of disputes on those projects. The numbers are a little bit eye-watering. Just do a bit of Googling and you can have a closer look. As I was sort of reading into these inquiries, one of them really I thought was a good one to deep dive into for this session, and just briefly. And this was the Perth Children's Hospital, and this inquiry was published just in March of 2018. And it really just gives us some insight as a classic example of, the lessons we should be learning from past projects. So it was a $1.2 billion medical hospital project, 298 beds and a research facility. And it was commenced construction in early 2013 and ultimately was completed on the 13th of April 2017. Only a small 591 days late. That's just shy of 2 years late. There was an enormous amount of media about what was going on with that project and the amount of problems it was suffering along the way. And these were the critical findings from the inquiry. First of all, they said the state accepted an extremely competitive bid from an entity without previous experience delivering a project of that scale and complexity. We've all heard that one before. Next, the inquiry was highly critical of a dual governance model the state put in place, which led to divided responsibilities and confusion and a lack of critical expertise. So they looked at the governance model. They talked about the poor and slow reporting, the reports coming up from the participants in the project being unwilling and reluctant to really talk about the gravity of the issues that they were facing on the ground. and the desire to paint issues in an overly optimistic way, being reliant on just sort of one party's perspective on what was going on. The Commission commented on the focus on the wrong thing. They talked about the board spent a lot of time talking about their gala dinner and not necessarily a lot on the actual issues that the project was facing. And lastly, there was observations about lack of ministerial accountability and that the government was adopting a reactive rather than a proactive position. And I don't know, I read these findings and I go, and you read something like this and then you watch the pandemic unfold around us. And for me, I took some lessons from this and some standout pieces, because we know we're going to have to deal with complex projects, complex events, and there isn't a single answer. And I think the dynamics of this conversation is going to show how dynamic the responses have been around the world and what works and doesn't work. It is complex, and it has to be very taking account that local complexity as well. So to me, I've got 4 outstanding lessons that really shine through for me. The first one is around expertise and the importance of having experts and experience around you, interpreting information at the top table. That and diversity of expertise is always one of my passion points. So that expertise point and your willingness to listen to experts is a recurring theme. My second one, it's often, you know, I think the industry word we all use these days is optimism bias, but to me it's about planning for reality, not what we hope will happen. So that comes in so many different forms, but planning for reality means we actually engage in project planning and the crisis readiness. You know, we really do appreciate the work done by institutions getting us ready for a bushfire or a pandemic, and that we respect those organisations, even if the event only happens at a very irregular time. Another element of this one is really understanding the past projects, investing in the lessons learned. We don't do that anywhere near often enough. And it is our human nature to be optimistic and think that everything will be right. But there's no better person as the person who's been through it before, and he can tell you all the lessons they learned from the last time. And good planning means you have those structures around you that you need to have when you're ready to respond. The third point I picked up was the right attitude of leadership and governance. And this has been picked up in the other conversations and the other comments already made. I tend to put it in this very simple way, is that good leadership looks for the bad news and treats bad news as good news. Or in other words, it's like, I want leaders, I want people in charge who are absolutely looking for problems. They're looking for them as early as possible, and they're tackling them as early as possible. They're not kicking it down the road. They're not saying it won't happen, because we all know that if you leave and kick them down the road, the problems just grow and grow. So that leadership mindset is a really important element of what we can do to do better. And then my last point was that investment in systems and structure, that links into the data and technology point that Ben was making as well. The better those structures are in place, the more options you have. There was some interesting comments made earlier around, you know, do you need what kind of hospital system do you need? If you have more options available, you have more temporary measures you can turn off, more if there's the Defence Force that can be allocated. The more options you have, the more awareness you have of those options, the more flexibility you have to respond to that crisis. I was going to leave it there. I would leave it with my mother's advice, which is a stitch in time saves 9, which I think sums up absolutely all of those 4 points. But hopefully we can get across to a broader, pass to the next speaker.
Kiri, thank you very much. I actually like the point you raised about, you know, lesson learned. It's interesting that you had to cite mega projects as a classic example, and we plan for earthquake. It doesn't matter how good we are with the prediction, but actually key point, do you plan for pandemic? If the biggest one was 1916 or whatever it was, you know, it's gone over 100 years before this came up. I think the key point that I pick up there, I actually like the issue about having the right expertise and experienced people around you, planning, you know, for issue about reliability and, you know, being optimism bias, which is an issue that's been picked up, and also understanding, you know, the past project and experience, which I think is quite useful, right attitude, And actually, you touch on subject which I know Tony, our president-elect, is really gunning for, which is about project governance, infrastructure governance system, which is going to be the theme of our conference this year. So a good point that you've raised, and I think we can build on that later on. So I'm going to invite Eric to actually give us our perspective, looking at it from ACEC, which is one of our perhaps the biggest member of the FIDIC membership, but looking at it from the market perception. So Eric, the floor is yours. Thank you very much.
Thank you, Nelson. Well, thank you all for having me. I am located about 100 miles outside of Washington, D.C., where we are just getting a foot of snow right now, which is a little bit unusual for us. So we're dealing with that as well. And so obviously, we have a very high infection rate here in the U.S. And really the conversation when it came to health infrastructure back when this all started was about, shoring up the hospital, shoring up that hospital infrastructure in order for us to flatten the curve. And, it seems that we did that fairly well. The US is a very large country, so we definitely have parts of the country where, it sort of came in waves and they were challenged around, having beds and facilities for folks. But for the most part, we seem to have sort of tackled that. But now we are facing having to have the infrastructure that we need in order to roll out the vaccine. So our new president, President Biden, has a goal of 100 million shots with his first 100 days in office. Now, that sounds like a lot, but very quickly, the pundits and the commentators here in the US, thought that that actually isn't enough. We have a very large population, and with the different variants coming in and how it seems that those in the US do not seem to follow social distancing guidelines like in most other countries, that we need to move really fast. So, what we're seeing now is for each state to have their own plan for how to address sort of that vaccine infrastructure, and with the support of the federal government. So this is really a very developing situation, and every state is very, very different. And we are definitely hitting some of those early milestones to get to 100 million in 100 days, but we have to go faster. So, and just a note, my 76-year-old dad has an appointment that we got within the first minute, my sister and I, of being able to go online to get his first vaccine tomorrow. And that will be at a CVS. So, in most parts of the US right now, it is, up to sort of the private sector, and most often that's going to be retail sector, to deliver those vaccines. And then besides that, we're seeing the setup of max vaccination sites in some urban areas. So, whether that be New York City Field or Fenway Park in Boston, that's where a lot of people will be going to get their vaccines. Whether or not we are ready to do this, again, is still sort of in development. But, what I do for ACEC here in the US, which is sort of what I'm going to talk about today, is sort of the market outlook, how this has shaped the market opportunities for engineering and construction related firms, as we're sort of looking to come out of this pandemic. So one trend, a couple of trends we've seen have really been accelerated. So one of them is sort of, what is called medtail here in the US, or the retailization of healthcare. So what we have seen is really in the last 10 or so years, a decline in hospitals and the number of classic hospitals being built with, standalone beds and those kinds of facilities. So we've gone much more towards an outpatient methodology to really standalone medical office buildings and other medical facilities, and even retailers like Walmart and some other retailers opening up sort of healthcare clinics within retail establishments. So we do not see this changing. We think this is actually going to, even though we needed those hospital beds for, those that were afflicted with COVID-19, we are still thinking that we're going to see the retail trend continue. And what's very, very interesting is that, as you all know, the economy has suffered, the retail market has suffered. So we're seeing a lot of stores closing, a lot of indoor shopping malls, and compared to the rest of the world, the US had a very high per person square foot dedicated to retail. So we're seeing a lot of those retail facilities of real estate sort of owners look to try to get those into an adaptive reuse setup to turn those into healthcare facility. So, obviously there are very different requirements for a healthcare facility compared to a store. So we'll see how that goes, but we do expect that to continue. Now, in conjunction with this, or the other trend that we're really taking a close look at is telehealth. So for us, that was already a trend that we were seeing, and now the pandemic has actually increased it substantially. And this is really because, during the early days of the pandemic, we did not want people going to the doctors. They just needed other non-pandemic related services. So I have a factoid here from the U.S. Centers for Medicare and Medicaid that on average 14,000 beneficiaries per week were receiving telehealth services in 2019. However, between mid-March 2020 through early July, the figure shot up to 10.1 beneficiaries per week. So from 14,000 to 10 million, is a huge swing. So we are really seeing that become an incredibly developing sort of story in our marketplace. And those that sort of do a deep dive analysis and forecast of this expect that in the future, 20% of all doctors' visits will be online. Now, most people don't think that's actually going to shrink the healthcare footprint, but your doctor's office may look different. And that goes back to what some of our other panelists said that were speaking before me, how is technology going to change? So, maybe instead of all of these different examination rooms that we've seen in the past, we'll see some of the rooms be telehealth rooms where doctors will meet with their patients, virtually. And, obviously doctors need to observe in a physical nature their patients. So often that's only good for maybe your first visit or something more simple, but we do expect that, that kind of technology will change how medical facilities are designed. So the other thing we're looking at is just those other design solutions that our engineers, our architects, and our construction professionals are going to have to come up with. So, as Anne sort of remarked on, the idea of more flexible spaces. So, how spaces can definitely be more flexible and not just serve one or two purposes. Also, and this goes back to technology, sort of touchless design. How can we enter and exit buildings without touching door handles, elevator buttons, and those kinds of things? Will we have big waiting rooms in hospitals and in healthcare facilities? Maybe not. You don't want to mix your healthy population with your sick population in ways that maybe we didn't think about before the pandemic. And then, of course, this goes back to sort of overall in the commercial real estate world is sort of healthy buildings. Here in the US, we've seen a huge increase in the well building certification process, which sort of builds on some of, the LEED and I think, BREEAM and some of the other international certifications. So we're definitely seeing that more interest in that. And then lastly, I just wanted to speak to, the market besides healthcare, we in the US consider separately our life sciences or science and technology market. So that is the market, where your clients would be pharmaceutical companies, biopharma kind of companies, universities, the folks that are developing the vaccine. So, there's a couple things that make this a very, very strong market, both coming into this sort of pandemic world that we're living in and also coming out. One is these folks generally cannot work from home. Your healthcare facility, your biopharma and pharmaceutical facility, these people have to show up to work. So as we're still wondering, is the office market and the retail market gonna look the same as we come out of this? Probably not, but that healthcare market and that science and technology market might in many ways still have many people coming to work and the demand should still be there. And we're already seeing that demand. So just another statistic for you guys. So the number of office space or commercial space that was dedicated in 2020 was a record high of 16% that was going towards life sciences. And that was more than double the 2019 figure. So the demand here in the US for that kind of space is incredible. The supply does not meet the demand. There's currently more than 36 million square feet being delivered. The big life science markets are sort of in Massachusetts, outside of Boston and Cambridge, in California, but there's others as well. But so a lot of commercial real estate owners and investors are looking for ways to turn office space or different kinds of space into life science space, and there's a lot of challenges with that because they have very specific ventilation, structural load for equipment, and other, needs that aren't often designed, before. But that just goes back to what we've been talking about, having to design for adaptable solutions and resilience in ways that we didn't think about. So, those are sort of the trends that we are looking at to help our firms and our members sort of understand where the market is going and how they can position themselves.
Eric, thank you very much for that. I think in a different perspective, but actually complementary, because what that is saying to us is that, yes, there are challenges in the marketplace as a result of this pandemic, but actually create an opportunity. So it's a telehouse, design solution, life sciences. I see a lot of opportunities. The question is, how does our industry respond to that? Now, at this point, we've got practitioners to pontificate on the subject. I'm now going to invite Graham to just give us 5 minutes, nothing more than 5 minutes. I know he's busting with a lot of statistics. 5 minutes just to share with us on the perspective from the FIDIC point of view. And then we're going to go into the question and answer session. So for those delegates who are actually waiting, so please be patient with us. We pick up questions very, very quickly. So Graham, can I invite you 5 minutes to give us headline on where you see? Graham?
Thank you, Nelson. So effectively, I'll start by going through some stats of effectively current situation, if you like. I'll then talk about sort of vaccination and potentially long COVID for a bit, and then sort of pontificate on the future, if you like. So let's talk about the moment. So 2020, 2021, it is estimated that COVID will cost the global economy $10 trillion. 10 trillion. Now, it's a very large number, and sometimes it's hard to work out what that number means. So, for example, if we were to build an average motorway with that amount of money, we would get to the moon and back 3 times. 3 times. So, I mean, we're halfway through the original NASA space missions. If you look at the US alone, for example, because a couple of the panel have mentioned it, it's going to cost the US economy $16 trillion just from COVID. Now, they're big numbers economic-wise, but let's look at some of the health stats. So, for example, in the globe, about 10% of global GDP is spent on healthcare. And about 1.2% of that, or 1.2% of that 10, is from public health services. So, the majority of spending on healthcare is not from public government bodies, if you like. But that ranges from everything from R&D right through to materials. So it is quite a broad sector. Now, interestingly, healthcare spending was growing faster than GDP up till 2018. So it was expanding. And then 2 years before the pandemic, that trend reversed. Looking back on it with hindsight, I think quite a few of us would say maybe we should have kept the growth up for the last 2 years before, but hindsight is a fabulous thing. So it goes to show that priorities were already shifting before this current pandemic. Now, if you look towards lower and middle income countries, in August last year, before we had the new variants and transmission went up, it was estimated that between 30 and $60 billion was needed to deal with the COVID crisis. And in the research that we were looking at, or that I'd looked up, it was, if transmission increases, you can treble that figure. And that was in August last year. Well, I think looking back on it, that was opening Pandora's box, because we may have caught ourselves out there, because it did. And so we could easily treble that figure. Now, if we look at the globe, we've seen lots of countries building healthcare type infrastructure. The UK, for example, built its Nightingale hospitals. The use of these has been, if you like, variable across the globe. And one of the things I'd like to stress here is it's not just about putting infrastructure on the ground, because like the consultancy and engineering sector itself, a lot of the value is in the employees and the workforce. It is okay having a hospital, but if you do not have people to staff it or the expertise to treat people, it is still only a building with 4 brick walls and a roof. And so it is important that out of this crisis, we value the human capital that is in companies as much as we do the capital that comes off of the stock market. If we now look to sort of going forward, So if you look at long COVID, there is an interesting concept that's coming out of COVID. So 1 in 5 people still have symptoms 5 weeks later. 1 in 10 people still have symptoms 12 weeks later. 1 in 20 people still have symptoms at some point in the future, which is still to be defined. Now, if you take that on health spending and you just do a rough figure in my head, that means that we would need to up spending by $300 billion a year just to keep the long COVID effects neutral. So resilience has been mentioned by quite a lot of the panel, but it could be argued that actually resilience is far cheaper than pandemics by quite a long way by the looks of it. If you then turn around and look at the vaccination program, we've had a lot of what has been nicknamed vaccination nationalism going on, which I'm not sure it's the most catchy phrase in the world, but we'll stick with it for the moment. If that continues at the moment, it is estimated that that will cost $1.2 trillion a year. So there is value being lost by not actually exercising global resources as efficiently as we could. Now, if we look towards the poorest countries or the sort of low to middle income countries or developing countries and vaccinations, you're talking about the cost of not vaccinating as quick or efficiently as we could do, and there being a gap between, as Nelson showed the map earlier, those who are and those who aren't, of between 60 and $340 billion a year. So every one of these actions, if you like, has a consequence and a cost attached to it. Now, to look going forward a second, to think about a few things, one of the Sustainable Development Goals, I think off the top of my head, it's goal 3, but I'm happy to be corrected if I've got the wrong number, is to ensure health. And one of those goals is for universal health provision. There are also things in there with regards to vaccinations and various other sorts of types of provision. The interesting question for me would be is that if that wasn't 2030 and it was 2025, would we have been in a better position going into COVID than we are now? And could we have done much better? And the question is should it still be 2030 after this, or 2050, or should it be 2025? Because I think a lot of people's perceptions on what they prioritize within government expenditure is going to change out of this. And that will also be key in the staff. And then there's other people, quite a few people mentioned technology. And as Nelson knows, I love technology. But we have things that have been developed as part of this pandemic we didn't expect. So if we take when they sequenced the human genome for the first time, it took over a decade. We can now do that in an hour. Could you imagine living in a COVID world where we needed over 10 years to work out what it was? We would definitely be in a very different situation. A lot of countries have put test and trace apps in. Why does a test and trace app only have to be for use in a pandemic? Why can't we use them afterwards and apply them to viruses that occur more frequently? These are the all resilience things that we could learn out of this pandemic, and taking the opportunity from it and the fact that there are lessons learned, I think will be important, not only for our sector, but a wide range of sectors going forward. And with that, I will hand back to yourself, Nelson.
Thank you very much, Graham, for that statistic, which is very worrying, concerning, but also actually quite interesting. It depends on which way you see it. Do you see the glass half empty or half full? At this point in time, I think we've had a lot of coverage from Anne, going across into Ben, and then we got Kiri, and then we got Emric, and now we got Graham. All of them talking about, yes, we perhaps could do more in our industry. I suspect at this point in time, my colleague Andy Walker is going to put some question across to me based on what's coming through from the floor. But before I do that, perhaps I can start off with question to each of the panelists just to give it a kickstart. Kiri, if I go back to you, and I think your question or the message you left with me was that complex projects require complex planning. And although that we may be having issues, which is to do with pandemics, but predicting when this is going to hit us is a major issue. And therefore, the issue about project leadership or infrastructure leadership or the way we deliver projects is going to be very critical. So what do you think our industry is doing, Kiri, in terms of, how do we get the message across to the client who tend to look at this project in isolation, and what I call procurement department are always looking at issue about transparency, accountability, and they don't want to deal with the big issue and the complexity. So Kiri, what is your advice to our industry in advising the client in going on this project, how should we better position and encourage them to adopt those message or lessons that you identify? Kiri, the floor is yours.
Thanks, Nelson. And that reflects some of the notes I was taking, and it's the language we're using and the kind of conversations we're having. So we've got to keep on challenging this very short, narrow frames of reference for projects. And to me, from a procurement perspective, because I really want to touch into procurement as one of the leading concepts, this is how we get projects up and running. The investment in procurement that's going to respond in a resilient way, that has a design sitting there for secondary purposes, that looks at transitions into operational use of facilities, that requires fundamental investment upfront by parties in a much broader way than what a lot of parties currently think. So if we can start changing the debate about procurement is not something in a box to be done over there by a procurement department, but it's to be done in a very wide macro lens with lots of perspectives on the table. And the other piece of language that really touched for me is I really want to stop talking about cost savings and efficiency and the cost of over design. There's this dive to the bottom dollar drives lack of quality, lack of resilience, narrow solutions. So we need to reframe what value for money actually really means for society. And it's this wonderful broad conversation that we've started having. So to me, we've got to change our language and our thinking. That's where I'd start. I think we've got a long way to go, but that's where I'd start.
Okay, thanks very much. I'm going to come back to Anne, who kick-started with this 3-point, which is construction program cost and design flexibility. And the question I'm going to put across is, I think the word is that if you look at the cost, in most cases, client invite us to tender for projects. And in most cases, we go with the cost, and then the department that is doing the procurement will come up with their contingents, and the contingent sometimes about 10%. And when you talk about that 10% contingency for the nature of the work we're dealing with, that is perhaps not necessarily will cover the cost. The issue that I have is, how do we build flexibility in our costing structure, that when we do have such a thing as pandemic, or we have to address that issue, how do we encourage the client to understand the need to build that into? Is it what Kiri is saying, is the language that we have to use, or do we need to educate them in a better way to understand the complexity that goes with the nature? Anne?
Oh, thank you very much indeed. That's a really good question. And it also is a very interesting point that Kiri talked about in terms of the holistic approach. And I actually think it does come back to this point about looking at projects and looking at delivery in a holistic sense. Because if you look at something about a project and a delivery mechanism just for that particular aspect or that particular element or that building or that tunnel or whatever, I think you're really missing the opportunity, and you're really missing what's needed to be done going forward. Everything is about putting facilities in for people. So we don't have anything, or we shouldn't have anything that's delivered if it's not for the benefit of people. We look at the social outcomes and so forth. So the language, I'm with Kiri on the language has to change. We have to think very differently about our projects. I'm really very strongly of the view that it's about social outcomes. We have to think about the social outcomes very much. We also have to think about what are the facilities for and what are the people's benefits going to be. Because I think it was Graham who said, we can deliver Nightingale Hospital's 4,000 beds in 2 weeks, but if only 58 people are being treated there, or there's nobody there to treat the people, then there's no point in delivering that. So it's about rethinking, it's about reshaping, and it's actually about going back to fundamentals as well. And it's about thinking about the fundamentals of what is it we're trying to achieve, who are the people we're trying to deliver for, and what is the best cost that we can achieve. And the value for money proposition definitely comes into that. But it's not just about the dollar cost, it's about the people cost, it's about the opportunity cost. I touched very, very briefly about the opportunities that the pandemic has possibly given us in terms of retraining local communities, providing facilities for people. And I think about this in work that I've done on refugee communities and displaced people communities, and thinking about, you don't just put the facilities in place for people. You help people to construct and create their communities and so forth. And then there's a pride of ownership and so forth. And this is a whole life cycle aspect. It's not just about that here and now of the opening, the cutting of the ribbon into a theatre or whatever it might be. It's about what is that in terms of its sense of place. It's a very convoluted answer, but I actually think the whole subject is quite complex, but it comes back to the fundamental point about what are we actually trying to achieve for people. And we can always find different ways of delivering and more flexible ways of delivering the outcomes and the solutions if we actually all think about what we're trying to get to as our end point. So even partway through a project, a pandemic comes along. Somebody in the chat box talked about, you know, pandemics coming along and changing the construction programs and so on and so forth. You can deal with those, you can accommodate those, but you need to have robust and honest conversations about what we're trying to achieve going forward, and we all need to buy in to the end result.
Sorry, Ben, I think my system is going into automatic, muting system. My understanding that you talk about resilient design, Ben, and you also talk about procurement, which I think is already being covered. One other point that you touch on is about digital and technology. And how do we do that and build that into it, such as digital twins? Now, I know when we're advising the client, we ask the client to build flexibility into their solution. And most of the time, the client is always very resistant to that. How do we overcome that? Is it, again, one of language? Or is it one about, educating them about what is the social value or the end purpose of what we're trying to achieve? Ben, your floor.
Thanks, Nelson. I think there's a couple of parts to this. I think first and foremost, you've got to go and Kiri touched on this, Anne touched on this. You actually do need to go back to the the overarching purpose and ultimately the people-centric side of this. You can't, as soon as you start in any of these issues, as soon as you start distilling them down to their nuts and bolts, you lose the race. So in terms of digital and technology here, so what ultimately is the if we pick the challenge around, let's take the example of spaces changing. Erin touched on this, and this trend is not happening to the same pace that's happening in the US and Australia. We're lagging. But if I think about what technology is doing to spaces in relation to hospitals, I spoke about designing a chassis. I spoke about there's going to be a lot, outpatients are going down, inpatient needs are going down, research laboratories will be going up in terms of planning for more intrusive surgery. That'll be less. There'll be more in terms of emergency department outcomes, etc. So there's those changes. So how is all that achieved? You have to have a system-wide understanding of what you're trying to achieve firstly. So it's being really clear on the need. And then simply it comes down to the basics of ensuring you've got the right people in the room. And that, in our experience, means you're drawing on people who aren't the typical people who are always in the room. They're not the senior executives from the health agency in jurisdiction X. They're not necessarily the most senior contracting person. They might be a completely different set of people. Kiri spoke of diversity of inputs. And so that diversity is in age, that diversity is in background. And when it comes to digital and technology, and this will be the same for Anne's business, I'm sure, the folks who are leading what we're doing in terms of whether it's twinning, whether it's VR, etc., they're not folks who are 55 years old. So that diversity is really important. I think that's the nub of it. And all of these, provided are really clear on the purpose at the outset. I appreciate, Nelson, that's probably not a technological answer you are seeking, but that's the way I'd be approaching it.
I mean, Ben, I welcome the idea of what you've raised. And I think I was going to go to Eric now and just pick up what she said about how, there's a change in the use of infrastructure now. And again, it comes back to the issue of resilience. I think she focused on life science as a classic area and saying that, now properties is being looked at as to how they can use that life science center. And this can create opportunity for different building. I mean, if you look at most city center right now with people working from home, it means by definition, most offices are empty. My office is virtually empty in Geneva. Maybe I've got 1 or 2 people. I cannot have more than 4. And if what Graham said is correct, that we're going to live with this for 2-3 years. So most properties in the city center will be empty. But you are pointing out that the life science technology sector will be slightly different. Does that mean that, when we start to build such a complex, we need to be mindful of that? And do you think we're doing a good job in convincing the client to build the flexibility in that sort of area? Eric?
Well, I think it depends on who the client is, and it depends on if they see value in it, if how the profit will work here in the US. So, when you're designing, one of the reasons the retail spaces, which is kind of strange, have turned out to work well as they transform into medical or life science facilities in some cases, is like the structural load. So the structural load for some malls and some retail spaces allows for a lot of people, a lot of inventory, and you've been able to adaptively reuse that space for healthcare spaces, which also have some demands on load, but perhaps the HVAC system is not the same or something like that. So, I think some of it is that what the pandemic has taught us is that the design and construction industry, at least speaking of the US, it can take years to retrofit, design, and build something. We go pretty slow, I even think, compared to a lot of other countries. So, the need to be faster and the need to be able to adapt faster in the future, and how that might help our clients, whether those are actual owners of facilities or developers, real estate developers, I think will help them. And then, the other point that I thought was really compelling that the other panelists touch on was sort of the discussion around social equity. Never before has the conversation in the US until these last 2 weeks been about designing for social equity. We have a situation where the vaccine is going to be free and everybody can get it, which here is a great thing and doesn't usually happen with healthcare. But if everybody has to use the internet to make an appointment and to get their vaccine, we have huge areas of the United States that do not have broadband still and do not have fast internet. So just, sort of a connected piece of that infrastructure and that technology is, even a couple of years ago, we would never discuss broadband or telecommunications as infrastructure that engineers have to be worried about. Now that is just as much of an infrastructure as a roadway. And, when we get ready to, do real spending, hopefully in this country and hopefully throughout the world on infrastructure, broadband is a big piece of that. And we're having to look for new solutions and new ways of delivering that because it's not profitable for a big telecom company to go put broadband in a small rural community. So we're having to think of new solutions and new ways to deliver that.
Eric, I mean, the subject you raised about, new way of thinking about what infrastructure is all about is actually very topical. If everybody is working from home or 50% of the population is working from home, as much as you go to work from traditional road or air, you either get congestion on the road. We're going to get congestion on 4G. We're going to get congestion on 5G. So the challenge is, when do we go to 6G? And how do we integrate that with different infrastructure? And how do we encourage sponsor of that particular investment to think about how best to connect, interconnectivity on that? So that's very important. I'm going to go to the floor now. Andy's feeding me with a lot of questions, and I'm going to try and address them. The first one is actually from James Dow. The question is, I'll put it across, that resilience comes from having an appropriate action plan in place prior to the problem arising. While plans for dealing with a pandemic were drafted into a number of countries, the necessary initiating actions were ignored by related government. How do we get government to act before the crisis hits us? So this goes back to the point that was raised by Kiri, that we can make prediction on earthquake, we can make prediction on this. The question, how do we get government to act before this crisis hits us? Now, Graham said, if we didn't pause on 2028 or 2018, and we continue with that infrastructure investment, maybe our resilience will be much better. The question for us as an industry, how do we get the government to act before the crisis hits us? Who wants to take a lead on that? Can I speak to Anne? Your thought on the subject, Anne?
Thank you very much indeed, Nelson. A very difficult question to answer, actually. But one of the things that I would say is that we have been doing a lot of discussions with various governments. And in my secondary role, which is global head of cities, we do a lot of lobbying, shall we call it, or discussions with governments about things that are for the benefit of the citizens and for the people. And I think that actually going in as a professional body, so not going in as our individual companies, I don't think that's appropriate, but going in as professional bodies. So for example, FIDIC going in and representing two governments, or the Institution of Engineers, or the Associations of Consulting Engineers, or other professional bodies coming together, I think is really, really important. And that gets a lot of traction. And we have been seeing a lot of success with that. Also chambers of commerce, so bringing in the discussions. So for example, in Hong Kong, I sit on two of the chambers of commerce, and we have been working together with our healthcare committee, our construction and infrastructure committee, and our smart cities committees. And we've been going and talking to government with these three different angles and three different positions, and talking about what we can do for A, coming out from this current situation, but B, going forward and thinking about the future. And that's very powerful because that's professional bodies coming together. And also, I think it's powerful because it's getting different viewpoints and different perspectives. So our healthcare committee is made up of all sorts of really interesting people from many, many different walks of life and many different angles and contributions. So it could be healthcare professionals, it could be planners, it could be engineers, etc. But I think that that actually is probably the best way that we can go forward. And as I say, FIDIC can play a part in this.
Well, I mean, obviously, I will support when I think one of the purpose of association is to be a catalyst for a positive change. Henry talked about it earlier on that, her role is to oversee the market. And I suspect when Linda Dar goes to the White House or talks to people, she will be using the information provided there. And I suspect, the data collected will come through the member association. I think, and the point you raised is quite valid. We are stronger together as an industry. We are stronger together as a body. And when we go as an individual, yes, we may probably get the road through as the CEO of a big company. But ultimately, when you come together as a community or a particular profession, they do listen. The next question I was going to put across goes into Kiri. Kiri, you raised the point earlier on that, when you go through the lesson learned from this process, I mean, I'm involved with a project currently, which was started with 15 billion and it's going to end up with 18 billion. And during that period, you have issues to do with COVID and all sorts of things. And all the points you raised about governance and learning from project, to be honest, Kiri, I went through that. So the question I have is that when you are engaging government, particularly when government are sponsoring this project, major project, how do we get our message across to them from the point of view of building the right governance structure and having lesson learned from those past projects so that we can actually avoid the same problem being made? How do we get that message across? Is it messaging, simply messaging, or is it something that you think industry body can take a lead? Kiri?
Well, I'm not sure we've been actually talking about governance of projects in a really constructive way today. We talk about the governance of companies, we might talk about the governance of projects, but I don't know to what extent there's a huge amount of information out there on governance. And it's an area that I've been thinking about a lot. And we keep on getting these examples of it was very driven by political reasons. They, it was the big showcase project. It's all about starting on this date, or it's all about cutting the ribbon. I think that was Anne's phrase, which is spot on. And those drivers are all about their political needs as opposed to the governance of the project. So I think, there's probably a great white paper about what is good governance, what is a model that will absolutely drive leadership that will find problems. I said, I've got my mantra now: bad news is good news on every project. And using technology is another piece. The reference class forecasting, the analysis you can do to flush problems up early. There is technology solutions in that space as well. So I probably have a half-formed triangle model of, you know, the leadership attitude at the top through to the information flows as it comes through all the layers with, you know, the leadership piece, that mindset, the attitude, the qualified experience, people who have done it before. We could probably create a great pyramid mask, which we could take to people and talk about. If you have these things and these things in place, you've got a governance model that has a better chance of running. The other one I want to throw in is I've actually really like the dispute avoidance boards that are part of that FIDIC suite of contracts. Because if you think about them, that's a group of experienced people who are independent, whose job it is to find problems early. So if you do nothing else on your project, put a dispute avoidance board in. It's stitch in time saves 9. People count the cost, but they forget about the cost of doing nothing.
Thank you very much, Kiri, for that. There is a question that came from the floor. I'm not sure whether it's a question or a comment, and it is come from Abjit Vaka. And I think the question says it boils down to finance that control the project or business owner. So as an engineer, a lot can be done, but it needs approval from the society and their leader. I think the message that's coming through here, where do we draw the line as an engineer where we're trying to prescribe a solution that may be that we need the society's need? On the other hand, we have the pressure of the accountability of value for money and public sector, you know, judgment. Because in most cases in public sector government, where those who are actually dishing out the contract, they're looking at benchmarking against past, and they're looking at accountability, and they have to go through that process when in fact, the concept of value for money is about how can you bring this particular project to a particular price when in fact it does not address society need. So the question I have there, which is actually going to Ben, we often have this issue in the health sector where they said the project will cost more and there are a lot of public inquiry that comes into that. The question is, how do we overcome the issue in terms of you have public sector who is deciding the price and how much you go, and we have our private sector where we are trying to deliver a flexible solution that can be adaptable, that address social need. How do we deal with that, overcoming that, Ben? Where are you?
Yes, Nelson. So in terms of, and how do you achieve that? I mean, that's, if I think from a professional point of view, there's a couple of different paradigms there. One is the one that none of us would support, which is just doing what we're asked to do for whatever dollar. And irrespective of what that means, because that's not delivering. I think Kerr spoke to the value for money as being a fundamental piece. A better way to look at any of the any such challenges does come back down to needs to be taken back up to the what is the you know, overarching purpose of whether it's an asset, whether you're talking about a health system, whether you're talking about whatever you're trying to enhance, you've got to get back to the original purpose. And then you've got to stand in the shoes, and this doesn't matter, in fairness, it doesn't matter if you're a structural engineer, whether you're an architect, whether you're a health agency executive. You've got to stand in the shoes of, you know, who this is ultimately for. And I'm sure we all do this. You think about this from a community point of view. You don't think about the health agency. You keep bringing it back to what's the best for project for community, not best for Mott MacDonald, not best for Aurecon, not best for other stakeholders. And if you keep holding that true, that's the best way to, so coming back to your question, that's the best way to challenge if there is a mismatch happening. And so you do end up getting a strong value for money solution that hits the mark in terms of what's required. You touched on things around the client will often throw to you, you know, benchmarking and say, well, you know, because of these 4 projects I've got here, it should be this, and that's all we've got to do with. Well, that's why we do what we do, because it's our role to provocate, to challenge, and to push back on that. A number of health agency clients say to me that they see our role is to protect their interests and to ensure that they get the value they're seeking from other parts of in what we're involved in. So that's probably my perspective there, Nelson.
Thanks very much, Ben. I'm going to actually bring Kiri back on. Kiri, one of the things that we face in our sector is the issue where we are brought in as engineers to do the conceptual design. And then it goes across into design and build, which is again, is some of the subject that's been talked about earlier on about procurement system. When it goes into procurement system, it goes to design and build, the engineers specify a solution. Then in the design and build process, you get contractor coming through about value engineering and bringing the cost down and bringing the cost down. This is a big challenge for the industry because by the time you do the value engineering, you don't actually get what was originally specified. How do we overcome that, Kiri? I mean, this is very much on procurement side and legal side, where you go re-engineering of the original design and you bring in that to the bone and effectively they see that as value for money. How do we overcome that, Kiri?
Well, I think we need to have a more complex conversation about what different contracts do. And there's we all probably got taught that triangle matrix, every contract will deliver time, cost, and quality, but that's not true. It also delivers collaboration, it can deliver innovation, it can deliver resilience. So I think we've got the wrong framework that we're assessing contracts against. So if you're looking at, client, you should choose D&C because it will drive costs down, that becomes a perversion in some instances about what you are actually getting for your project. It drives a whole suite of behaviors that says the only thing that's important is I get the cheapest product and that's all I care about as the client. So I'd really like to see us reframe what the different procurement models do. I get particularly concerned, particularly when we're talking about health outcomes, community outcomes, D&C models, PPP, the EPCs, they're very rigid models. They're not very flexible models, and they're owner hands-off model. Now, there are projects which that's completely fine, but it's not always the case. And I think we've got that as too dominant a model, and re-empowering clients mean re-empowering their ownership of their projects, what their quality, what their values are, and putting different, more flexible contracts in place that they can be the active participants and decision makers in.
Yeah, thanks very much, Kiri. And that brings us back to the point which I know that Bill is always passionate about. How do we regain our position to be that trusted advisor? There is a question specifically that is coming through from the floor from Shambrook KC, and is directed to Anne. I'm just going to put this one to Anne before we go through the closing round. And the question goes is, how can developing countries afford the temporary facility for COVID-affected patients? I suspect this is a broad issue, and I suspect you can spend a whole day answering the Anne. I mean, we heard in China, they build fantastic infrastructure within a very short period. Not all parts of the world have the same money and flexibility as China. Let's look back into developing country. What advice can we give developing country in overcoming building a very quick temporary facility? Anne.
Thank you very much indeed. It is a fantastic question, and it is one that we could talk a lot about. But I think it comes back to the nuts and the bolts of the question, which is, what do you have available? What facilities do you have available? Do you have playgrounds? Do you have sports fields? Do you have some schools? Could you actually modify these? Could you adapt them and so forth? I have seen many examples of temporary field hospitals being created out of schools, out of facilities, out of small, quite simple structures and so forth. I've seen many field centres being created with tents and tented structures and so forth. And these are across different places and not all in developing countries. I've also seen quite a lot of really good examples of having the facilities created, like using containers, for example, and repurposing containers into temporary accommodation or quarantine facilities, etc. So it's really about what do you have available to you and what can you get people to staff up and to provide the facilities. It's not one answer fits all. It's definitely look and be resourceful. And I think that Kiri used this quote about a stitch in time and so forth. I want to use a quote about the necessity is the mother of invention. And the necessity that we have at the moment will create lots of inventive solutions. So use what you can. Think about the fundamental situation. Think about the cleanliness. Think about the masks. Think about the basic infrastructure, about the water and the cleanliness of the facilities, social distancing, and then I think move forward and don't hesitate looking for the perfect solution. Get the solution that fits you at that moment in time.
Right. Thank you very
save
much.
lives.
Yeah, thank you very much, Anne, for that. Very keep it simply. I think you said find the best solution that's available. Don't look for sophisticatedness, look at simplicity. At this point in time, before I bring Bill in, I'm just going to ask a question to all the panelists before I bring Bill in. And the question is very simple. We've actually gone through the process now, and the question I'm putting across is, have we learned from this pandemic? And do we actually feel that we have a better understanding of the situation and the challenges that we need to achieve in the next 18 months? So the question is time to vote. Have we learned from this pandemic? And do we think we understand the challenges and what needs to be achieved next? Question. Time to vote. It'll be interesting to do that. While I'm doing that, I'm waiting for Bill. Bill, at this point in time, I'll be delighted to invite you to come in to say a few words, having listened to all the panelists and a lot of subjects being talked about. Once we get the decision from the poll session, I'll invite Bill to say a few words. Barbara, are we ready to go with the results? Barbara? I think the answer is, have we learned from the pandemic? Yes, we definitely have learned from the pandemic. Do we think we understand the challenges and what needs to be done? 62% feel we do understand the challenges and what needs to be done. Now, Bill, the floor is yours. We've got 2 minutes for you to give us your perspective on the conversation. You've listened, you've been around. So what's your take, Bill?
It's been a terrific conversation, touching on many elements of our challenges, and it would be impossible for me to summarize them. I want to really thank the speakers for very diverse comments, and you know, they were really spot on. A couple of the themes you touched on, one of the some of my pet kind of things, Nelson. You've known me a long time, so you know what I love the term trusted advisor. I like the concept being brought up of the race to the bottom, you know, of bidding, and going with low cost kinds of procurements and the problems that all causes. There's a couple of other quick themes that rang a bell with me, and one is identifying problems early. That dispute avoidance concept is exactly why we have that in the contracts, and I know many of us, including the firm that I've spent my career at, always encourage project managers to identify a problem as soon as you know there's a problem. Get it back into the firm so we can start helping each other fix it. The earlier you get at the problems, the better. That was the case before COVID. It's the case now, and will be the case after COVID. And the final thing I think we all got verification on is the world is going to be different in a lot of exciting ways. There are real opportunities that we're finding out, not the least of which is how we use data better and technology in producing documents. One final thing, people mentioned the challenge of moving experts around the world in the COVID environment. And I look at that as slightly a different way. With the kinds of tools we have, I think, you know, via Zoom and teleconferencing and robotics and drones and all of that, you can really get the expertise of experts without the expert even leaving their house, let alone their office. So that's something I think that we ought to think about as well. So thank you again very much for a terrific conversation. Back to you, Nelson.
Thanks very much, Bill. I was going to put one question to all the panelists just to close out in my usual rant. So Barbara, just be patient with us. I know we are time sensitive. The question I'm going to put to all the panelists, I'm going to start from Anne. It's very simple. If we were to rerun the last 18 months in one sentence, what do you think would have done differently? Anne?
I think we'd have thought about this being a longer term issue and not thought about it being a very short term, easy fix, 3 weeks, and it'll all be over.
Okay. Ben, what's your take? Ben?
Nelson, just learn from the past better. I don't think we've learned from the past as well as we could have. Before the pandemic, we haven't learned from the past.
Learn from the past. Okay, thank you. Kiri?
I think there's power in looking at, the countries that responded best and the qualities of those and chase those down. There's some great leaders, great countries who did some great things with very limited resources.
Okay, excellent. Yeah. Eric, your view?
I would think that how humans and human behavior influences the way that we design and construct, because we can't predict what our fellow humans are going to do, and they've surprised us. So
Good. Graham, with the statistics and all the words and everything, what do you think we can learn from the last 18 months that we could have done?
Share information earlier and act faster.
Okay, thank you very much. Sharing information you've heard from the panelists. I'm going to sort of wrap up now, and I'll go you through. We started with Anne, which gave us the 3 point really about construction program, the cost, and designing flexibility. And there's a lot that was covered during that period. Ben talks about resilient design, talk about digital and technology, and there's procurement. And we also have issue that was raised by, Kiri talks about, learning lessons from the past, and the big issues about case studies. More important, there were issues to do with getting the right expertise and experienced people, planning and having some reality check, not underestimating the project complexity, right attitude and leadership and governance, and the issue about investment in system and technology. In the case of Erin, we have the issue about what is happening in the marketplace and how there is a shift in activities, particularly on MedTel and Telehealth, an issue about the what I call the life science changes. And more important, she raised the issue about design solution. Now, Graham gave us a lot of statistics, and if you look at it, it sounds very depressing, but actually, if you flip it side, it tells us there's lesson we can learn. We need to continue to be in the advocate mode. We need to encourage government sometimes to think seriously before they make some dash decision. If we hadn't reduced the global spend on health in 2018, maybe reaction at the moment would be less, worrying. I suspect when you go through the actions that, sustainability development goal, which he talked about, number 3 is critical, that we have the responsibility. And when you look through where the vaccination is available and the speed of implementation, this is going to be a challenge for us for the next 3 years. I do take it that, we do have some real challenge ahead, but I think our industry is very resilient. We've seen it being responding to the market and the challenges. And I do believe that our industry continue to do that. The only challenge I think we need to do is very much taking the message from the World Health Organization. Solving the issue of vaccination in the Western Hemisphere is one part, but solving it globally is another part. And if we do one without the two, we're going to have a problem in the future. And that problem means that you're going to have national boundary, you're going to have people actually, creating boundary, and you stop movement of flow, and the whole idea of well-being of society will be questionable. At this point in time, I just want to remind everybody, it's been a pleasure to have the panelists. There's a lot of lesson learned, design, it's a flexibility in the attitude, looking at issue about retaining local staff. I think Anne talks about that. Looking at the purpose of the venture and having the digital built into it, the issue about professional body coming together and acting in the right direction, and then there is the issue about best value versus cost. How do we get the best value into that process? These are the issues that we need to. And I will just finish up on the message that Bill said to us: getting engineer to be trusted advisor. We should not walk away from our responsibility to make sure we constantly remind the client of the true value of what we are designing. Sometimes we go for the shortcut by going for different procurement process that do value for money come down to the bone. But at the end of the day, the structure or the infrastructure facility does not serve our needs. So again, we are going to continue with our FIDIC community webinar. We're going to continue with the state of the world, and we are going to continue with the COVID-19 in 2021 and 2022. So please continue to join us. The issue about the Future Leaders program, which is about to start, for those who have young ones in your institution or your organization looking to become more familiar with what consulting engineering does, there is still opportunity for them to apply for the FIDIC Future Leaders program, which is available. On this note, I'm really going to thank everybody. I want to thank Bill once again for beating me to the issue. One day I'm actually going to worry whether Bill is going to tell me, Nelson, I'm too tired, I can't join you. But Bill, thank you very much for your time and for your leadership in supporting us on this program. So far, so good. You've taken 100%. I'm slightly below you in your attendance. I want to say thank you very much to Anne from Hong Kong and China. Thank you very much to Ben from Australia and Kiri from Australia, and also Erin from United States, and our Graham I was going to say from Geneva, but not Geneva, but perhaps in UK. And also to Andy Walker, who is behind the scene, Barbara, who is behind the scene, and also, the rest of the team, Nadia, who are supporting, and Chanel. Thank you very much for your time. And I hope you keep safe wherever you are. At this point to say thank you very much for your contribution and stay safe wherever you are. God bless. Thank you very much.